Health news tonight, helping older Americans regain their ability to read.
As we grow older, eyesight can diminish. News 8's health reporter Jocelyn Memento with more on what's available for patients battling macular degeneration.
All right, Ms. Graves, come on in.
Emma Graves is still fairly mobile at 93 years young, but her ability to see is slowly diminishing. Regular eyeglasses no longer work for her.
I couldn't see to read or write, and I love to read.
Mrs. Graves has macular degeneration, a progressive condition that impairs central vision. There is no cure.
Macular degeneration, you never go completely blind. You always keep your peripheral or side vision. You can always walk. You know where you're going.
But now telescopic eyeglasses are enabling patients like Mrs. Graves to read again. Fine print, not so challenging anymore.
We call it a wow factor sometimes. We'll put these glasses on and we'll see a smile back on their face.
Optometrist Dr. Randolph Kinkade at Vision Dynamics explains.
Power is put into the scope. Prescriptions are put into the back of these lenses. And this allows us to maximize vision with someone's correction in it.
Dr. Kinkade points out eyes see differently, so different lenses are needed. Mrs. Graves only has one lens.
For reading, because we have to hold it so close, we can't get the two eyes to converge.
Patients, he says, relearn the ability to see.
The macula is the center part of the retina, and sometimes we need to learn to look off-center a little bit, to use a different part of your vision that you haven't been accustomed before.
The ideal candidate for these high-powered glasses?
Someone who is struggling, that they're having to use a magnifier, they no longer can read their newspaper.
I feel much better.
Mrs. Graves no longer drives.
I do a lot of puzzles and things, you know, to keep myself, my mind active and everything.
But her quality of life is much improved.
What I've got left.
In Cheshire, Jocelyn Memento, News 8.